This brief video is intended to share some information about LifeNet, one of the programs at AANE, the Association for Autism and Neurodiversity. The presentation will quickly tell about the who, what, where, when, why, and how of the LifeNet Case Management and Independent Living Support Program for autistic individuals living in the community. So first of all, who are we? Each adult enrolled in LifeNet works primarily with two individuals, a clinical case manager, who we also call a personal advocate, and a support partner, who has extensive clinical training and experience, including but not limited to that of a direct support professional. So in addition to this primary team of two, LifeNet adults are also able to work with our administrative and clinical leadership, which includes our program director, associate program director, and clinical case supervisors. And last but certainly not least, LifeNet adults have opportunities to connect with peers who are also enrolled in LifeNet through weekly offerings of social activities, which are both virtual and in person. So next, what do we do in LifeNet? Well, we provide independent living support and accompaniment during one-on-one virtual check-ins with the clinical case manager or personal advocate, one-on-one in-person visits from the support partner, and finally, small group activity offerings. The virtual clinical check-ins tend to be shorter, but oftentimes are more frequent than the longer in-person community-based visits with the support partner. For each LifeNet adult, use of the one-on-one time looks slightly different. It really depends on what the adult's preferences and needs are. Often there's a sheer benefit just by having someone known and trusted check in on how things are going, how you're feeling, help you identify and address daily needs that need problem solving, or maybe help research and connect with new opportunities and community resources. Our team plays a valuable role as part of the support network and can help you grow and maintain other connections as well. Now and then, the time is spent doing something pretty concrete, like checking mail, paying bills, responding to emails, going shopping, planning what to eat that week, scheduling doctor's appointments, organizing in the house, learning how to get around in the neighborhood, or applying for or renewing or maintaining things like government benefits or insurance. This is just a short list of examples, but hopefully you get the idea that sometimes it's really action-oriented and other times it's mostly focused on company. To continue on the what of LifeNet and expand upon that third component, the small group activities, these can be a variety of in-person or remote opportunities that gather folks to discuss a particular topic or share in an activity. The calendar offers several times a week, and the times of day vary. Some popular activities are a dinner at our office or an online transportation discussion group, also an online trivia group, or our in-person walking group. We ask LifeNet adults to recommend activities that they would enjoy, and we invite you to co-host those with a staff member. Next, I'll talk about the where of LifeNet. Well, as I said earlier, the one-on-one virtual check-ins with the case manager most often occur over video chat. And then the one-on-one in-person visits with the support partner most often occur at your home. But they can also take place out in the community or at our office in Watertown. The where for our small group activities, as I've said, has been online, at our office, or at public locations within our geographic reach. And our geographic reach for where the clients live that we serve is generally a 1-hour radius from Watertown, Massachusetts, within about an hour of our main office. Next is the when of LifeNet. When do these interactions occur? Well, the one-on-one virtual check-ins with the personal advocate occur 1 to 4 times a week. They do occur every week for the most part. And the one-on-one in-person visits with the support partner occur either monthly, bi-weekly, weekly, or sometimes twice a week. This depends upon the service tier level that you are enrolled in as a LifeNet participant. Most of these one-on-one encounters do occur during normal business hours, and most small group events occur during business hours as well. However, some certainly do happen in the early evenings. The other component to know when thinking about the when of LifeNet support is to know that outside of business hours, so on the weekend or over a holiday, we do have a LifeNet team member that monitors an on-call telephone, and LifeNet adults have access to call or text this number if they want to try reaching someone for remote problem-solving support. It's not an in-person on-call service, but it is a telephone number to reach someone in a more timely fashion than waiting for the following business day to talk through a problem. Next is talking about the why. It's really hard to boil down into a minute or less why we do what we do at LifeNet. Passion and impact must be the two best words to sum it up. But to elaborate a little more, one of the key motivators that keeps us moving is our ability to support personal and support network growth for individuals who otherwise are at high risk of isolation. In our annual surveys over the years, we continue to get this feedback from both our adult participants and their family members who observe this benefit. So it's really that personal growth and the support network growth that do motivate us to continue doing what we're doing. Secondly, we do what we do to support the mental and physical wellness of autistic adults who are at higher risk for poor health outcomes than the neurotypical population. We see a reduction in peer isolation, a greater compliance to medical appointments and instructions, and improved responsiveness to emerging health needs. And third, we are encouraged by the increased self-advocacy and confidence that we see in our clients. We're moved by seeing that over time, at an adult's sometimes slow pace, there is a growth in self-advocacy, openness to exploration, and decision-making. Next, the how. Well, how do we go ahead and do all of this? The guiding force really is following our mission and the philosophy of AANE and LifeNet specifically to empower autistic adults to pursue and maintain connections to live the life that they want. We use our training in things like executive functioning support, motivational interviewing, emotional regulation, health promotion, philosophies regarding dignity of risk, the social model of disability, self-determination, and adult learning theories, our knowledge of psychosocial needs, and more. We implement all of our education and training around this to provide high-quality support. We also wouldn't be able to do what we do without the support of AANE, our parent organization, which has a breadth of knowledge and history supporting the autistic community. And finally, in terms of the how we operate, we are a privately funded program. So please, as a next step, complete the online questionnaire to tell us a little bit about you, and we will reach back out quickly to schedule a time to talk so we can further discuss our LifeNet program, answer any questions that you have, and get to know you and determine if we're a good fit for you. Thanks for listening.